Maria Boyer. I'm an internal medicine physician at Mayo Clinic, and I'm the person who takes care of America's grandpas and grandpas. I'm glad you brought up this problem with Medicare, because Medicare is the problem with this rising healthcare costs. In order to fix Medicare, I have a couple suggestions. The primary care doctor needs to be adequately reimbursed for time spent with the patient. I can spend an hour with a medically complex patient, but only get reimbursed for 20 minutes of my time. And all that cost then is shifted to people on private payers. Lack of time with the patient equals shotgun testing, expensive referrals, and increased costs. Okay, so more time with the patient is the key. Number two, I think the lack of market forces is sending Medicare into bankruptcy. Americans need to get over the fairy tale thinking that you can get health care for little or nothing. And that I know there's a lot of debate about that, and I think we need to think about, well, it has to be on a pay level. I mean, as far as if we want patients to get the care they need, there has to be some sort of, just rallying on here, but anyway, I think that we could solve a lot of problems if we just have the wealthy seniors pay more of the real cost of the care that they're getting, and that might reduce costs dramatically. And I think that a little pain in the pocketbook might make people very smart quickly as far as making those costs. I think that tweaking the Medicare system with a value index will likely reduce costs and improve quality, and I agree with that. I think we absolutely need to do that. But I don't know if it's going to reduce costs long term, because there's a huge wave of boomers coming into Medicare in the next decade, and even a value index will not change the entitlement mentality of our consumers. So I just wonder what you guys think.
Great, thank you for your question.
Yeah. Well, again, I would go back to the entitlement mentality.
Tim, can I call number 212 up next?
Sure.
212 will be next, or excuse me, after 107. We'll get 107 and 212.
Okay, no, I think you bring up some good points on this. The entitlement mentality, again, that does go back to, as I started this, we're going to have a national discussion on this. Is it an entitlement no matter what the economic situation of that family when that small what is it, are they entitled to go in and get care? And if it's done, I'm just asking, we continue.
If Art Schmidt is here, would you go to the back of the auditorium, please, and go outside? Your friend is not well, so he needs you right now. Art Schmidt?
So I'm asking the question on this, and I agree, and we're talking about this. You talk about the market reforms. The problem is that it's very difficult for us to get that, because one of the things is, the one thing I think some of you need to know, I spend a lot of time working on the VA. And the one thing about the VA is, and I think Dr. Wood may agree, that there was a book out, Best Care Anywhere. The VA delivers incredibly good quality care. But the VA in Rutgers, by independent measures, we can see that. And some of you, and I understand how this works, is there's always individual, we can always do better. One veteran not receiving the care is we have to do better. But I think to condemn the whole system would be truly unfair by the numbers. But one thing that the VA does that I think helps us continue to make improvements on this, you hear these stories about, and this is one that I'm just curious about. They had an incident where they weren't cleaning the equipment right at one hospital, and we had several veterans that were infected with HIV or I'm not sure what else we had in them, but I think there were 2 cases of HIV that were by them absolutely unexcusable, absolutely unacceptable. We went back and investigated. I had the manufacturer of the machine come in and all this, show me what we needed to do. Here's the issue though with the VA. They are required in any adverse reaction to report that immediately and publicly, and you will know. Now, one of the issues we have when we talk about this is, we don't get that necessarily in the private sector. We know that we've got medical incidents that cause about our medical error somewhere, and I don't know if this is disputable. I think it's pretty solid, 92,000 deaths a year. So we've got some issues here on this free markets, I think, but I go back to on this, the mentality of entitlement or whatever. We need to have that discussion in this country. We want people to take responsibility. We want people to do the right thing, but we know right now if you're uninsured or you haven't done that, your choice is when that child cracks their head is to show up at the emergency room and you will treat them with the best care of any place in the world. But it's going to be not necessarily the most efficient, it's not going to be the cheapest by any means, and that cost is passed on to you in a $1,075 tax every year that you're already paying for. My question is, wouldn't we make more sense to catch that on the front end, get a more market-based approach, give them money, get them cared for? And I'm not sure if you're going to say it's totally market-based, it's totally free market, whatever, we all know that there will be winners and losers, and we know that there will be market failures. Are we willing to accept that in this country, that a market failure or a winner and loser would be that child not getting the care they need?
Is routine and expected, so you can have people have healthcare savings account for the routine expected care.
Take an appendix out at Mayo Clinic.
I have no idea, and that's part of the problem. I have no idea. Yeah, so that's part of the problem. There is.
Would you guess it's $10,000?
I have absolutely no idea.
Would I be in the ballpark? Phil, you probably know more about the cost. What's it cost? $18,000. $18,000. Average salary in this district is $42,500.
Cut taxes.
Pardon me?
Cut taxes.
Okay.
Plus tax. Good point. So my question to you is, how long is my on $42,000 a year? How long do I have to stay to get to $18,000?
Well, but okay, so what you can do then is have it based on ability to pay. So you have the healthcare savings account which is routine care, and yes, some seniors couldn't afford much, you know, a buck a month, you know, some seniors can afford to pay 50% of their care. So, you know, to have that based on ability to pay, but still having some, you know, market forces here to help reduce costs.
No, that's a good point. Dwayne, can we add in on this? And I'm not going to put you on the spot on this, but Dwayne's approaching this from a business perspective. One of the things of making sure, from the chamber's perspective, and things, making sure that we do this right, and this is a suggestion on this, where do you guys come down on how to make this happen, or how to make sure that, because one of the issues here is that small business owners now, this is their single biggest expense. This is very, very hard on them in trying to figure that out.
I think generally the public option, as it's put out in the press and not specifically understood with the big boogeyman word, it would probably be agreed that we are very skeptical of the benefit to the system. For either employers who have full coverage systems, employers who have very minimal coverage to their systems, employers who have no coverage to their employees, and then business owners like myself where I've got 4 employees and 55 independent contractors. Independent contractors, and that's a growing segment of our society right now, typically get none of the tax benefits, none of the negotiating benefits, none of the grouping benefits, and none of the ability to defray or somehow share costs across, except for the fact that most of the insurance carriers will carry a catastrophic pooling across the top of their systems. That's uncovered, usually in the real estate business. That's 25% of the realtors are out there with no insurance at all. May or may not have sufficient income, but clearly don't have sufficient income to pay for a basic, straightforward. That's 1 out of 4 of the folks that are in that industry. And I would say that if you went to most independent contractor industries, that would be similar. So as a business owner, the labor contract negotiations part of our society has developed a system where the employer can package benefits into their tax deductibility. Independent contractor cannot. So it's areas like that as employers, we look at things and say, some of these should also have the dials switched a little bit to try to spread either the benefit or the cost, whichever way the dials go. And I'm not choosing a way. I'm just saying, let's work the dials so that maybe more of society, more of the laboring society is able to access the system in a fairer, if you will, or a more equal scenario. I know that Insurance carriers struggle with this because oftentimes an insurance carrier is bidding for the job that's been negotiated at the table. And so there's that conflict of I'm bidding for something as opposed to packaging something and offering it. And those are all factors. They are market force factors that are happening. We support those kinds of things, but there are aberrations that need to be dialed, and we believe that there should be some support for that also. Even though we're vehemently market-based people, we have very strong feelings about that. In a real world, we know that these dials do have to get reset because there is not any business out there that's going to be able to either stay in business or maintain reasonable employment for their workers with this system continuing to spiral the way it is.